On February 29th and March 1st, 2024, Kigali hosted the East African Clinical Officer Harmonization Workshop at Lebanon Hotel. Participants from various East African countries, including clinical practitioners and representatives from regulatory body health institutions and unions, gathered to discuss and collaborate on harmonizing practices in the field of clinical officer.
Before I continue to talk about the reason why we are here, let's first of all recognize all the delegation.
RTD Major Jean Damascene Gasherebuka, CEO and the Registrar of RAHPC, welcomed the participants from different countries. He explained the reason for the workshop following the recommendation of East African Community Clinical Officer and emphasized the reason for mutual recognition agreements.
The reason we are meeting here, it's following the recommendations of the ESC, Sector Ministerial meeting that was held in Burundi in February last year, where it was recommended that health professionals which have not yet started their harmonization process to start the process.
He appreciated the job done by clinical officers who are still helping in harmonization procedures. The guest of honor was the Director General of Health and Quality Services from Rwanda's Minister of Health. He explained how coming together, sharing their professionals will help population from member states to have a good quality of services.
East Africa Community Partners was starting to begin this the possibility of harmonization, which in terms of service, quality of service, in terms of how we can be dealing with this professional in a harmonized way. It is started by this member state to come together by having like sharing of experience in a way how can be our population having the same quality of services. And in that circumstance, we need to having the regulation for the council or the other member state to have this. And this, it comes for providing through education, registration, and the academic institution with various including like admission, the different requirements, and the training at the same academic issues. So when it comes to dealing with health professionals, it comes by these health councils to be among the team lead for having quality services in the community. So when you pass through on the burden we have in Africa, most specifically in sub-Saharan Africa, we still have the gap in terms of half workforce. The workforce is in a challenge when you see the density in terms of workforce. The ESA member state, we still had lagging behind. When you see check on data, the member state, we having the EC, we have like less than 2 health workforce in a 1,000 population. This is showing how the burden it is in the disease management. So we need to have this critical thinking on how to increase the number of workforce.
He said that the challenge is workforce, meaning that it is still minimum. He explained how harmonization will facilitate the free movement of labor force from one country to another. He also emphasized that the only thing that can help the member states is mutual recognition agreements.
Workforce. So by increasing the number of workforce, they need like in terms of quantity, but we need what we call quality.
President of GACOPA, Austin O'Deal, delivered his speech on how harmonization will benefit them once they promote equity, transparency, information sharing, and easing mutual agreements across member states.
Further, our pursuit of regional integration and harmonization requires that we recognize the critical role of healthcare in fostering the well-being and prosperity of our citizens. Healthcare knows no borders. Diseases, pandemics, and health crises transcend geopolitical boundaries. As such, it is incumbent upon us to forge a collaborative framework for the regulation of healthcare practices that transcends national frontiers. However, the lack of harmonization in healthcare regulation across our member states presents significant challenges, and there are disparities in standards, qualification, and licensing requirements, not only that these undermine the quality of care, but also impede the free movement of healthcare professionals within the region.
Each country representative provided an overview of the organizational structure and the functions of clinical officers in their countries. But they kept on repeating that the clinical officers are needed in the primary health care sectors because their numbers is still small according to the amount of population in the states.
We have 30,000 clinical officers in Kenya, 30,000. But if you look at the population of the country, where we say we have 56 million people, 30,000 is a very small number. Among the doctors in Kenya, we have about 10,000 doctors. The majority of the Kenyan population lives in the rural areas, and that is where the clinical officers are. When you have any medical problem, including an emergency maternity case or a simple injury to your little toe, the nearest person who can help you medically is a clinical officer. With 30,000, in a population of 56 million, I am telling you, you need a medical person harmonized across the region so that anybody can step in to help you. Clinical officers in primary healthcare may be the single most important solution going forward into the future.
When it comes to the employability level, in my country, in Burundi, clinical officers are employed by government, by private sectors, and they can even work in pharmacies. But guess what? They are not working as clinical officers, they are working as nurses, because there is a scope of practice issue also. There is no package of what they have to do. There are confusion. And when we introduce these things of clinical officer, now they don't get anymore. That's why still problem. Yeah, but at least they are employed, even though they are employed as nurses.
For Uganda, we are ready to observe the decision of Council of Health Ministers in EAC as regards clinical officers training and practice. And that is why we are here together with our head of clinical officers and allied health in the country, Professor John Charles Okiria, because we are observing the decision of the EAC Council of Ministers. And we hope to participate fully in this harmonization workshop and put in place whatever will have been decided in the workshop for God and my country.
The primary focus of the workshop revolved around the essential objectives aimed at fostering a unified curriculum with the field. A central goal was to collaboratively construct foundational and harmonized curriculum.
So what do we need to do as technicians to have our curricula standardized? The process of making something conform to a standard, I think he has labored to explain that, and I won't go much into it. We've seen the standards we need to put in place such that we can benchmark ourselves upon them.
Participants engaged in comprehensive discussions regarding the intricate processes involved in developing such a curriculum, encompassing both the content and the contextual aspects essential for meeting the professional's requirements. The deliberations were directed towards ensuring that the curriculum not only adhered to standardized guidelines, but also reflected the diverse needs and the refinement inherent to the professional across different regions. By delving into the creation of a curriculum that resonated with the specific context and the demands of clinical practices, the workshop aimed to lay the groundwork for a harmonized framework that would enhance the consistency and the quality of education and training in the field. To effectively address the workshop's objectives, the participants implemented a structured approach by electing a delegate to spearhead the proceedings. Through a democratic process, a representative was chosen to guide the collaborative efforts towards achieving the desired outcomes. This appointed leader assumed the responsibility of facilitating discussions, coordinating activities, and ensuring that all voices were heard and considered during deliberations. Drawing upon their collective expertise and insights, the participants collectively worked towards formulating resolutions that encapsulated the essence of their discussions and the agreements. These resolutions served as actionable plans and guiding principles to steer the harmonization process forward. By entrusting a delegate with leadership responsibilities and collectively arriving at resolutions, the participants demonstrated their commitment to driving meaningful change and advancing the shared objectives of the workshop.